Good morning. This is Tuesday, February the 3rd at 9:02 a.m. and I call the TennCare Subcommittee to order. At this time, I have asked if he would, Dr. Kumar, to lead us in prayer and then the pledge.
Well, thank you, Mr. Chairman, and good morning to all. Kindly join me in prayer to our Lord. Almighty God, we're grateful for the gifts of life and liberty, love and happiness, and family that you have given us. You have also given us the gift of democracy, and we seek your presence among us as we serve our fellow citizens and make decisions that are meaningful and important. We are grateful to you for that privilege, and we ask for your presence among us. May we use those privileges as you would want us to. We ask for your continued presence and grace upon our fellow citizens who have suffered greatly during the recent weather catastrophe. This we ask in the name of your precious Son. Amen.
Amen. If Dr. Kumar would lead us in the pledge. Thank you so much, Chairman Kumar. At this time, if all members would make sure that they have logged in. And Madam Clerk, if you would take the roll for us, please. You should have a blue button to pop up if you're logged in. Should say roll call, shouldn't it? Okay, Madam Clerk.
Mr. Chair, you have 7 members present. You have a quorum.
Thank you so much. And we appreciate our Sergeant at Arms. We appreciate our clerk, appreciate our staff. This is our first meeting. And so I tell you what, first of all, we'll start, if he don't mind, we'll start over here to my right on the end with Chairman Sapicki and let everyone introduce themselves, and then we'll move right on into our business today.
Thank you, Chairman. My name is Scott Sapicki. I serve in District 64, which is the eastern side of Murray County. I've served on the Insurance Committee now for going on 8 years, and I'm very happy to be here, Mr. Chairman. Thank you.
Thank you.
Well, good morning again. I'm Sabida Kumar. I'm a retired surgeon. I represent District 66, which is Robertson County, immediately north of Davidson County. And our slogan is, minutes from Nashville, miles from ordinary. Thank you.
Thank you, Chairman. Sorry, I was waiting on you. Well, I represent District 81 in West Tennessee. Yay. But I represent Tipton and I guess you call it a little bit of the western part of Haywood County. And I am a wife, a mom, and a grandmom. I'm Nana. And so I can't wait to get home on the weekends, but I'm glad to be here. And I have the honor to chair calendar and rules. So I look forward to seeing most of you if you behave. So thank you.
Thank you, Chairman. Mike Sparks, District 49, Smyrna, North Murfreesboro, and Laverne. I've been serving, I guess, going on 16 years. I want to give a shout out to my new intern, Jacob Pagel. or bagel, like bagel, bagel. Bagel. Anyways, he's an MTSU student. Really proud of this young man. Even though he's in a wheelchair, this guy will outrace me, just like you. I seen one day you got in the Capitol before I did, but we had the Secretary of State in recently touring our new $400 million investment to Smyrna Airport with the National Guard, and you were right there with us the whole time and came to our Rotary Club. So y'all make my new intern feel welcome.
Representative Love.
Thank you, sir. Good morning. Harold Love, District 58 here in Nashville, Tennessee. I represent a portion of downtown, and I got 4 HBCUs in my district. I'm happy to be here on my 14th year in the General Assembly and glad to be on this TennCare. Came in 2012. That's correct. Yes, ma'am. So thank you for being here, Mr. Chairman.
Okay.
Thank you, Mr. Chair. I'm Representative Antonio Parkinson, and I represent Shelby County, and particularly the Raleigh and Cordova area. And speaking of Raleigh, Raleigh is the first county seat in Shelby County. So it's actually the capital of Memphis. And so I represent that area. And I'm honored to be here. I'm on my 16th year. So most of you are junior to me, Reverend, right? And honored to be here. Thank you, Mr. Chair.
All right. And I'm Chairman Michael Hale, serve the 40th District, which is Cannon, DeKalb, Smith, Jackson, and a part of Wilson County. So very honored to serve. I own a funeral home. My wife and I have a wedding venue, farm, still do some preaching and fill in. So very busy life, but a very blessed man. I've got 3 children. Losing track of the grandchildren. I think we're up to 5 now. Of course, we had one that passed away at 4-year-old a couple of years ago. So very blessed and honored for the opportunity again this year to serve as the chairman of the TennCare Subcommittee. Mr. Parkinson, yes, sir.
Thank you, Mr. Chair. Mr. Chair, that's new information to me. I didn't know you had a wedding chapel and a funeral home. So basically you marry them and bury them.
That's right.
Okay. All right.
So also, if our staff would introduce themselves very quickly, please.
Hi there, Ryan Valone, House Research. We're working with all you guys again.
Jackson Lilly, Representative Hale's Legislative Assistant. Great to see y'all.
Levin Crutchfield, Office of Legal Services, Staff Attorney for the committee.
Haley Bishop, House Clerk.
All right. We're glad to have each one. It takes everybody to make things work. And so does anybody have any personal orders? I know Chairman Sparks has recognized Jacob. Jacob's a guy that I have come to appreciate the friendship that I have with him and been at several events together over the last few years. And so, Jacob, it's good to see you and glad to have you down here. Just be careful what you're running around with, okay? Chair Lady Moody.
Members, I'd like to introduce you to the intern we have this time for Calendar and Rules, Sydney. And Sydney is from Nashville, but she goes to ETSU. So will you welcome her?
All right. Any other personal orders? All right. If not, then we'll get right into today's business. First, item number 1 is House Bill 1101 by Representative Salinas. Representative Salinas, you are recognized.
Thank you, Chairman. I would like to roll this bill 2 weeks if possible.
Roll this bill 2 weeks. So
Yes.
without any comments or questions, we will roll House Bill 1101 for 2 weeks. Next, you've got item 2, so House Bill 1104. You have a motion and second, and you are recognized.
Thank you, Chairman. I would also like to roll this bill 2 weeks.
Okay. So without any further comments or questions, House Bill 1104 will be rolled 2 weeks. Thank you. Next, item number 3 is House Bill 1393 by Representative Pearson.
Thank you.
You have a motion and second. Representative Pearson, you're recognized.
Thank you so much, Chairman and members of the committee. I present to you House Bill 1393, Medicaid Expansion Package. This legislation I brought up now 3 times in this legislature because this issue is of that much importance. The reality is this is not just about Medicaid. This is about making sure that the human right to healthcare access is true for everyone in our state. I've talked with a doctor who talked about a patient coming to them who had cancer, but they did not have access to medical care. In our state, should that doctor deny them treatment? Should that doctor turn them away because they do not have access to health care? I believe that we have a responsibility, an opportunity, and a moral obligation to have legislation that is both compassionate, but also invest in the people who call Tennessee home. If you look at our state just quickly, we have the highest medical debt of any state in the United States of America. The uncompensated care costs that hospitals cover due to people using the ER as their primary care end up being passed to individuals who have insurance. One way or another, we are paying for the cost of people not having care in our state to the tune of roughly 340,000 people. And one of the questions that we must ask ourselves as state legislators is, why is it right for people who pay for our right to have health insurance, for people who go to work every day, who pay for you and I through their taxes to have health insurance, to be denied access to health care by those same representatives whose health care they pay for? This bill would cover nearly all adults under the age of 65 with incomes up to 138% of the poverty level. Now, if we're looking at an individual, that's just $21,600 a year for someone who is single. That's how poor you'd have to be to get access. But the truth is, some of them are not able to access the marketplace, and they're not able to access TennCare. So there's a coverage gap. That is what this legislation would do. 41 states plus the District of Columbia has already expanded access to Medicaid and to healthcare for people. And we have to realize that you got folks who are home health aides, food service workers, childcare workers, gig workers, veterans transitioning back into civilian life who don't have access to healthcare even if they work. Because just because you have a job does not mean that job has to provide you access to care. This will reduce the number of people who are uninsured. It would ensure that people are no longer relying on the emergency room for preventative care, when in fact they could have primary care that would prevent this problem in the first place. And I'll tell you one of the stories that really touched me. One of my interns, grandmother, told his mom to stop paying for her medical care, stop paying for her medicine, because she didn't want them to have medical debt. 3 days later, after no longer receiving that medicine, she died, because we haven't expanded access to Medicaid in our state. Rural hospitals in part of my district, northern part of our district, which we're close to sharing in Tipton County, is more rural. And over 16 hospitals have closed over the last 16 years because we have not expanded access to Medicaid in our state. Thousands in Shelby County, over 70,000, are without access to health care because we have not expanded Medicaid. This is an opportunity for us to have a serious conversation about why. I wasn't here when the decision was made for this legislature not to allow for the governor to enter into this agreement, but we, as people of good conscience and having some morals, should decide that every person has a right to health care. Everybody. And we're talking about people who are working, who are giving of their time and their life to take care of their families. And our state has a responsibility to do all that it can. And we as legislators have a responsibility to do all that we can to expand access to Medicaid. So with that, I yield for questions.
All right. Thank you, Representative Pearson, for that explanation and for your comments. Representative Parkinson, you are recognized, sir.
Thank you, Mr. Chair. And Representative, thank you for bringing the legislation. I was here when Insure Tennessee was not heard. And it's sad and unfortunate, because I think back then the numbers were somewhere in the realm of 370,000, 320,000 people that would have, or the working poor, that's how they labeled it, that would have had access to health care. And I'm not trying to insult anyone, but that is probably the most diabolical thing an individual could do, is to deny people the right to live in a pro-life state. And you know, so, and it wouldn't, we already paid for it,
That's right.
but we basically gave Arkansas and Kentucky and other states that did expand Medicaid our money to insure their people. And that's sad and unfortunate. And what it was even more sad and unfortunate is that because we made that decision not to allow people that access to healthcare, somebody's family member died. Literally, their blood is on our hands because we did not allow or give access to someone that needed that access to healthcare. So I thank you. I appreciate you bringing the legislation. I'm going to be voting for your legislation. So.
I appreciate it. Can I say something to the chairman?
Okay.
Thank you.
Representative Peterson.
And I know we talk a lot about fiscal impact and the consequences. This legislation, part of the reason it was so unique when it was initially brought forward from the federal government 16 years ago was that 90% of the cost is already going to be paid for by the federal government. Only 10% is paid for by the state. And so to Representative Parkinson's point, our federal tax dollars are already being used in other states where this expansion has happened to ensure their citizens, to ensure their residents. We have paid this money to the federal government, and billions of dollars that we were supposed to get in order to ensure our population, we no longer have. And the number, and you can look at the fiscal note here, but the cost to us would be roughly $234 million with the gain of federal expenditures of over $2 billion. Paying for healthcare for the people in our community, not the $2 billion price tag. We pay $200 million and get $2 billion back to make sure that people in our communities, and it's in all of our communities, in every single one of our county, there are people who are uninsured. There are people who are dying because they don't have access to healthcare, and we have an opportunity and an obligation to do this. And again, go to the fiscal note. It explains the matching funds at a rate of 90%. Only 10% is going to be paid for by the states. And I know initially the Hospital Association said that the hospitals would cover that 10% cost, so it would be zero cost for our state, which is something I know that we can continue to look into and potentially have happen again. But I'll just read this last assumption. An approximate 340,000 new individuals would now be enrolled in health insurance and can receive healthcare services that they are not currently able to receive. Individuals may experience improved health outcomes due to increased access to healthcare services, resulting in savings from total healthcare usage over time. If we get people access sooner, we don't have to continue to deal with the worst outcomes that again become uncompensated care costs that we pay for through higher premiums. So if we start to give people the medicine that they need, make sure that they get the preventative care on the front end, we don't have to deal with the consequences of them being denied access to healthcare. And so it isn't just that this is a moral imperative, it's just the recognition that the sooner we take care of people's health, the better and more able they are able to participate in our communities, continue to go to work, go to college, have a family, build a life as healthy people.
Okay. Representative Parkinson, you're recognized.
Thank you, Mr. Chair. I think it's important to note two things. One, to your point, that if we were to give people that access, I think it's worth looking into how or if our GDP as a state would increase, because there's a lot of loss in work and productivity because people cannot go to work because they are sick and they don't have that access. Another point that I wanted to make, and I think that this point has gone missed by a lot of people, a lot of us, is that expanding Medicaid is not only an idea that would give people access to health care, but it is a huge economic development bill and deal, because once Medicaid is expanded, many or a multitude of new businesses will open up in order to facilitate this 340,000 individuals that now have access to health care. That's transportation to visits. That is more supplies being brought into the market, more possibly hospitals opening up or staying open, wellness cares, doctors, so on and so forth, especially in rural communities.
Yeah.
In rural communities. And if we look at what the governor's strategy is in allowing for full practice authority with nurse practitioners, physician's assistants, If that is to come into play, and we did have this access for, those communities that have limited opportunities in wellness and health access, this would be an incredible game changer for those in those rural communities and those in our state. So thank you again for bringing the legislation.
Thank you.
Representative Love, you're recognized, sir.
Thank you, Mr. Chairman, and Representative, thank you for bringing this legislation. Again, looking at the fiscal note, one thing that I do note that it says is that it decreases state expenditures over time of the uninsured adult healthcare safety net. I too was here when Insure Tennessee was proposed and did not get the support that it should have. One of my concerns was always the unintended consequence of not expanding Medicaid from the perspective of rural hospitals that then closed and forced people to either not get care or to seek clinics, or in the larger scheme, go to our safety net hospitals in our 3 grand divisions, Region 1, Erlanger and Chattanooga, Metro General and Nashville, and that caused a burden on the people traveling to have to come that far. And so one of the questions I would like to ask you is, what effect do you think this legislation would have on reducing maybe the burden on those hospitals of caring for persons in the urban area that could then go to their hospitals, some of which probably could reopen or provide other care for a person if they had the census numbers to increase? What effect would that have on reducing maybe the burden on those hospitals in those urban centers?
Representative Pearson, you're recognized.
Thank you, Chairman, and thank you for the question, Representative Love. Look, I think the reality is there are so many hospitals that closed that people would have preferred to go to rather than going to Region 1, rather going to the big box hospitals in other parts of the state. And there have actually been some really sad stories where people have tried to get to Region 1 or have tried to get to these other larger hospitals and have died on the way. Right? Like, that was entirely preventable.
Sure.
Because a lot of people, and if in my hometown, right, like you want to go to hospitals where you know the doctors, you want to go to places where you know the people. And when those hospitals close, you're losing someone that may have been your doctor your entire life, or your kid's doctor, or your grandkid's doctor. You're losing relationships, and you're being forced to now go to larger hospitals where people may not have the same understanding of your community, the issues, the problems. And again, people are literally dying on their way trying to get to a hospital. When we have the authority, we have the power to ensure that our governor and our government actually provides access to healthcare for people and either rebuilds, reopens, or have the building of new hospitals. Because the reality is these 16 hospitals, the infrastructure is likely still there, and they could reopen if the clients, if the people were there to be able to use it as their primary care and not only as emergency rooms. Like this just makes sense. And it's not political. 41 states, including the Washington, D.C., has done this. So places that have been led by Republicans, places that have been led by Democrats, realize that healthcare is a human right. And no one should be denied it just because of the state that they live in. And we have an opportunity to not only just have a serious conversation, but truly push to provide access to healthcare for people, whether they're in urban areas, suburban areas, or rural areas in our state. But I will say, for people who live in urban areas, because we have so many hospitals, we're able to receive or get access to those hospitals, right, for emergency rooms. But still realize there are 70,000 uninsured people in Shelby County. Right? And so people are accessing the hospital, but the cost is still being borne by the hospital, which ultimately gets borne by people who have insurance, and that increases our premiums. And we know that these corporations they're going to make their profit from somewhere. And we have an opportunity to change that paradigm. But thank you for your question.
Okay.
Chairman Love.
Thank you.
Representative Love, I'm sorry.
No, thank you, Mr. Chairman. So I would say this also. I think that there's an opportunity for us in this committee. I know we have a apprehension sometimes of even whispering Medicaid expansion for fear of what may happen. But I think there's an opportunity for us to take very seriously the long-term consequences of not providing persons with a minimum basic level of insurance that can give them the confidence that they need to be able to go to a doctor, to not put off care, to not try some other remedy and then maybe cause their illness to be even worse.
That's right.
Because they have tried to doctor on themselves. And so I think we have an opportunity in this committee to at least, I would say, members, push the legislation to the full committee to allow the full insurance committee to hear the bill and to debate it properly. And then if we decide in the full committee not to advance it to Finance, Ways and Means, or your wonderful committee chair, Lady Moody, but at least give it this full measure of being heard so that members can understand the benefits that we're talking about in this bill. So I would ask members to support this bill and get it to full committee.
All right, thank you. Chairman Kumar, you are recognized, sir.
Thank you. Thank you, Mr. Chairman. Thank you for bringing this topic to discussion again. I've been here about 12 years. Over the years, we've discussed it a lot. And I was here when Insure Tennessee did not get heard on the House side. As a physician, I have sat in situations in a small cubicle with a patient who has a serious problem, usually a cancer, and they do not have coverage. And yes, how can you not be but sympathetic to that situation and to that life? And for that reason, I am generally sympathetic to having a means of providing care who cannot afford. Healthcare being a need for all of us at some point in life. But also, we have to realize that the structure that TennCare is being offered is the most inappropriate way that Affordable Care Act was organized. It was organized in a way that if your income is up to a certain level, you can get subsidies. But if you're too poor for that level, then you have to go to the states to do that. At this time, you're saying that the federal government will give $2 billion. And my question has always been, rather than leaning on the states to do certain things, that is to pay 10%, as well as the administration costs are probably another 8 to 10%. If by leaning on our states to that degree, they're making it difficult for them. The analogy has been that I want you to adopt this baby elephant. I'll give you all the chow that the baby elephant needs for 3 years, and then you're on your own, or subsidies from the federal government go down. And that baby elephant tends to grow, or is going to grow, and the cost can really become very difficult. That is what happened during the administration of Governor Phil Bredesen. TennCare budget became from 1/3 to almost half of the state budget. And he had to take off about 200 to 300 people off TennCare at that time. As a practicing physician, I saw that unfold. I knew that. So I've never understood, if federal government wants to give $2 billion for care for the indigent in Tennessee, why don't they just do that? Make them the same things available that are available to those people who can go to healthcare.gov and be able to get coverage. It's insisting on states to take on a responsibility that in the long run they may not be prepared to. Your bill at this time deals with taking the legislature out of input and advice to the governor whether to expand TennCare or not. The measure that you're trying to undo is basically that governor can proceed with requesting coverage or requesting expansion of TennCare in Tennessee without legislative approval. And being a legislator, I think you should think twice about taking the legislature out of that decision making. I think since we are the ones who will manage the budget and make appropriations and so on, if we deserve to, we definitely need to be involved in it. The last thing I would like to say would be, kindly, those who are listening, be aware that patients do get care. I think that's an exaggeration that patients are dying on the way to the hospital because they didn't have coverage. No, you can have coverage and still the disease and the illness and the medical condition can be such that a person sadly passes away on the way to the hospital or arrives at the hospital too late. There are many factors involved in that. Patients generally do get care. Having practiced surgery for 43 years, I never came across a situation that a patient had a serious condition and could not get care. Care is given. Hospitals are generous. They have charity compensation that they receive from the federal government. And physicians it is their oath to take care of sick people, okay, and do no harm. It is our oath, and we would, for me, an investment of taking care of a person who does not have coverage but has a serious illness meant to nothing more than time, 2 hours, 3 hours, 4 hours, or some, over several weeks or months of care. To me, it was always investment of time. And I was always grateful that I was able to provide that. I looked upon it that God put me on this earth at this point and in contact with this patient for a particular purpose. So kindly be aware that patients do get care.
Right.
Thank you. Thank you, Mr. Chairman. Sorry, too long.
Thank you, Dr. Kumar. Representative Pearson, you're recognized.
Thank you so much, Chairman, and thank you, Representative Kumar, for those points. And if I could just take them sort of piece by piece, let's talk about the financial component first. If I told you the state had to provide or bring forward $100,000, and then I would give you $1 million, or if I told you if you give me $1, I would give you 10, it's hard for me to believe that that's not some sort of positive deal. And for the states that have expanded Medicaid or done Medicaid expansion through the Affordable Care Act, we have not seen the federal government taking away the agreed upon support that came about 16 years ago. And so the idea that you're making related to Governor Bredesen, that there's going to be an explosion, then somehow we're no longer going to be able to pay for it. Similar situation. I also want to say, the ask for 10% is not absurd, with 90% of it being paid by our tax dollars already to the federal government. And other states have already decided that Tennessee citizens paying for their health care at 90% is better than not having health care for those who are most poor in our communities at all. To your point about the legislature needs to stay involved in the process, I would ask, and I know there have been so many versions that you've probably seen over your many years of this legislation that may look like it's taking the legislature out of the process. But my colleagues, that's not the case. This legislation clearly says the governor, acting through the Commissioner of Finance and Administration, is directed to submit to the Federal Centers for Medicare and Medicaid Services an application for a new waiver no later than 180 days after the effective date of this act for people who are at 138% of the federal poverty level. This legislation itself is the legislature saying what must be done. I don't want to take us out of the process. I want us to direct the process. And as I'm seeing the governor deny 700,000 kids access to food because he's not funding the summer EBT program, I don't want to leave anything in his hands. I want us to direct him to make sure that he expands access to healthcare. And so this is making sure that our legislature stays involved in that process. And I just think to your other point here about patients do get care, that is 100% accurate. Patients do get care when they go to the hospital and they go to the ER. But the problem is their uncompensated care cost when someone doesn't have access to insurance. And so ultimately, to your point, we are relying on charity instead of relying on systems to ensure actually people are getting access to healthcare, not just at the ER, because people do. If you go to the ER, you will get seen. You will also get a bill, but you will get seen and you will get care. What I'm saying is we can prevent people from going to the ER in the first place if we provide them health care earlier on in their lives. And that is what this opportunity that we have before us would do. And so it's the uncompensated care costs. And when I mentioned people dying on the way to the hospital, it was also in reference to this reality. Some hospitals are so far away from communities that people don't make it in time. Whereas when we had 16 more rural hospitals, people were able to get to those hospitals much more easily than they were able to get to some of the other Trauma One centers in larger hospitals in particular jurisdictions. But I thank you for your input, and I hope to have your support on this legislation to keep the conversation going forward.
Chairman Kumar, follow up.
Thank you. Sure. That 90 to 10% spread is for about 3 years, and things begin to progressively grow. That was the original program. Yes, I see reference shaking their head. If that has changed, let me know, but it is supposed to be for the first 3 years, and then the state shares progressively grow.
Yeah.
That is how the system is. And once again, there are many reasons for hospital closures in Tennessee. It's corporate reorganization, it's hospitals that don't have enough clients and so on.
Right.
But please also be aware, on the one hand, we say hospitals are closing because we don't have enough patients. Then we want to give them TennCare patients. Then we say TennCare, we are losing money every time we treat a TennCare patient. Then, I mean, how is the hospital going to be more solvent if we are giving them more patients upon which they lose dollars? They lose money for treating those. It becomes very confusing and going around. I think we're using arguments to serve our purposes. But at the same time, I think above all in our minds needs to be the plight of the patient whom we're trying to serve and our citizens. And I told you I was sympathetic to that. It's just I don't like the system that it is being organized under. Really, there is no reason for federal government to segregate the poorest of the poorer, the most vulnerable, and put them in a situation at the mercy of the states. They really should have been given the same privilege than those people whose income was maybe 5% or 10% more, and they should also be able to go to healthcare.gov and get 100% subsidy and have coverage. It's a very, very simple administrative fix. I don't like that we are being bullied into expand your Medicaid system, then you can get those people covered. We'll give you 90% of the money for the first 3 years, but why don't you use that money to give them the vouchers to go get coverage at TennCare.gov? Really, that would be a little too simple, wouldn't it? Thank you, Mr. Chairman.
Thank you, Chairman Kumar.
If I can give just a last point to that, Chairman.
Representative Pearson.
Yeah, Representative Kumar, you know this, but I'm running for Congress and I'm going to change it with your help. And so we can work on that and what the federal government should have done previously. But what we have in our hands and what we have is an opportunity. This is a system that we have that 41 other states have done to expand access for their people. And this was the system we've got. And it's the one that we can improve. And that's what I hope we are able to do. Thank you.
Representative Love, you're recognized.
Thank you, Mr. Chairman. And I just want to get clarification from the sponsor about the legislative intent. It's my understanding, and members on the committee can also chime in and correct me if I'm wrong. TennCare is our waiver from the federal government Medicaid program. So TennCare in itself is a waiver we requested. It's a waiver we requested decades ago. Mm-hmm. We recently, in the last 3 to 4 years, made changes to our waiver. Mm-hmm. And it went back between administrations, got approval, came back to the legislature, and we voted on what was submitted. You're simply asking, if I'm correct, and I don't want to put words in your mouth, but correct me if I'm wrong, or confirm this, that we update or change our waiver as exists now to include more people. So you're not doing away with, but augmenting the current waiver that we have, which is TennCare, if I'm correct.
Representative Pearson.
Thank you, Chairman. That's exactly right. You go to the legislation where I left off. It provides medical assistance coverage for individuals whose gross annual income does not exceed 138% of the federal poverty level, which again, we're talking about poor folk who make about $21,000, a single person, $21,000 a year. I don't think anyone in this committee makes $21,000 a year. We're talking about the poorest people in our state who don't have access to healthcare. And what we currently have is leaving 340,000 people without access to healthcare. All the systems, all the programs, everything that we've got, all the charity is still leaving 340,000 people in the gap. And to your point, Leader Love, Section B, a waiver requested pursuant to subsection A, if approved by the federal government and the Commissioner of Finance Administration takes effect immediately. So yes, it is a waiver just to ensure that people who are the poorest in our society, the poorest of our constituents, get access to health care that they pay for us to have. You and I go to the doctor and are able to use insurance that's paid for by people in the state of Tennessee's taxes. And 340,000 of those people who go buy something from the grocery store, because we've got a grocery tax, have or pay the sales tax, 340,000 of them today don't have access to health care. And we can change that.
Thank you. Representative Parkinson, you're recognized, sir.
Thank you, Mr. Chair. I wanted to just swing back to, the charity care and safety net, right? And this is where basically, we dump people that do not have access or do not have insurance, that are uninsured. And I would venture to say, that not a person up here on this dais would want to be dependent upon the safety net that our state says is the catch-all for those individuals or citizens that don't have insurance, health insurance. And I asked, what's the difference in the services or the coverage between our safety net and people on TennCare? And I was told there is much more access and choices over here. And over here, you actually got people to answer the phone. And over here, you can actually get appointments. Now, these are the things I'm saying. They didn't tell me that. Of course, they're not going to say that, right? And over here, the people with TennCare, you can get appointments faster. And it's such a huge difference because if you are a safety net provider, you are not going to be ripping through the process to see as many people as you can because the budget will not permit it.
That's right.
And let me go back to that earlier statement that I said. Not a person up here would want to be dependent on the safety net of our state to be their healthcare provider. And to the individuals that to the commissioner that I asked about the difference in the safety net versus people actually being on the rolls of TennCare, my point to him was, if the safety net is so good, then we should all be on the safety net. And why are we not all on the safety net and saving the state this ton of money? Because we're all on the safety net. But the safety net is trash. I know it. He knows it. The people that have to depend on it know it. And what was incredibly intriguing to me is that many, not myself, but many of us up here are receiving state-sponsored health insurance. But at the same time, telling our citizens that we cannot even have a discussion on the idea of them having state-sponsored health insurance that I can guarantee you that has probably saved the lives of some of the individuals that are members of this body. Last thing I want to point out is this. One of our colleagues had a traumatic emergency in a rural community that once had a hospital. and that hospital closed. But, our colleague was airlifted to a hospital, I believe in Memphis, where his life was saved. Everybody's not going to get that benefit. Everybody's not going to get that privilege, that opportunity. And if an individual was on the safety net, we don't know what that outcome would have been. So again, I thank you for bringing this legislation. It's very important legislation. And I think at a minimum, we should allow this legislation to be heard by the full committee so we can add more voices to it. And not necessarily saying to pass or fail it, pass it or kill it, but just to have a real, true, and honest discussion about how this is affecting the quality of lives of our citizens here in Tennessee. So thank you again.
Thank you. That's my last mention.
Representative Pearson.
Yeah, but I'm at the will of the committee on that. I will say to a point that was mentioned earlier, initially this legislation may have had a step down, but as of 2020, the federal government has paid 90% of the cost for the expansion, Medicaid expansion. And so it has remained at 90% and 10%. And even there's a new incentive since 2021 under the American Rescue Plan, where states that do expand receive a 5 percentage point increase in their traditional matching rate for 2 years, which more than offsets the 10% cost of expanding in the first place. And so at least for those 2 years, we wouldn't see a cost at all. And when we are talking about healthcare, we have to look at what is happening in DC too, right? With the Affordable Care Act, subsidies expiring or people not being able to have access to healthcare in that way. And so we're going to have more people in our communities who are going to be in need of access to healthcare who do not have it because of the failure of other people, right? Not us, but we can only do what is in our power to do. And as state legislators in the state of Tennessee that has not expanded access to Medicaid, we can direct the governor to apply for this waiver to care for the poorest people, to make sure those who are sick have access to health care, and to prevent people from being sick in the first place and to save some lives in the process. Thank you, Chairman. God bless you.
Thank you, Representative Pearson. Last week, I guess it was, week before last, we had a presentation from TennCare in full insurance. Director Smith, I remember some of the takebacks that I got out of that presentation was the fact that, when we look at the expansion states over since the Big Beautiful Bill and now the Health Rural Transformation Act, there's been cuts. But thankfully in Tennessee, we've not seen cuts in rates. And when they start having cuts in rates in those expansion states, my fear of this is that when we start doing that, then we have less people getting served because we have less providers, and then we struggle with getting providers to even take care of our people. There was a lot of information that was laid out in that presentation that I think greatly affects Tennessee, and I think today, because we are not an expansion state, that we see we're in a much better place. For the record, to set the record straight, I don't get state insurance. I pay for my own insurance. Just to set that record straight. Representative Chairman Sapiki, you are recognized, sir. Okay. Anyone else? Chairman Sparks.
Yep. I appreciate your passion for healthcare. Many of y'all know I lost a sister last year, cancer, seen her in a nursing home suffer for 7 years, and not a pretty sight. But when I look where this country is going, I'm not trying to preach to anybody, but I watch that debt clock. I don't know who y'all watch that debt clock. Who all watches a debt clock? Am I the only one who watches a debt clock? Okay, a couple of y'all. Anyways, I got grandkids. Really worried about where the future of this country is. When you have grandbabies, and we're 38 trillion, $690 billion in debt and growing. I wrote an article about this probably 6 years ago, and the debt was 21 trillion. You know, I see where the Trump administration is investing. Was it 206 million, Chairman, to rural healthcare? And I like the governor's comments last night, thinking outside the box. And I got tired of standing up, and I was getting some exercise in. Chairman Kumar last night, up and down, up, down, up, down. I was talking to a guy this morning on the way in here, and I kind of seek his advice. And I said, I've got this bill that's going to try to cut taxes off fresh fruit and vegetables. And he said, what's the fiscal note on that? And I said, well, it's only $90 million. He said, man, y'all got to be careful of cutting taxes all the time. I run 2 tax cut bills, First Amendment tax cut, Second Amendment tax cut on gun safes. Really wasn't that much money, but I think it's a step in the right direction. Like with the governor's after, I'm going to follow the direction of a healthcare expert, which I see in Chairman Kumar. I love your passion. Wish you best luck in Congress. And has your opponent tried to take on this issue?
It's a good question.
You're recognized.
Thank you, Chairman. Look, what I do know is we need more from everybody.
Yeah,
and
I agree.
When I talk about healthcare for everybody, what I haven't heard today, even in the dissent, is how are the 340,000 people who are uninsured because we have not expanded access to Medicaid, who making $21,000 a year, going to get access to the healthcare? And I appreciate some of my colleagues and Chairman, you mentioned you're paying for your own insurance. You do not make $21,000 a year. You have the privilege to have access to not just private insurance, but also government-sponsored insurance. You have a choice. And right now, and what Representative Kumar did mention, is that there are people in our communities who do not have a choice. They do not have a choice to get access to healthcare other than the emergency room. And so when we are looking at this, it is about whether or not we are going to legislate with the people who are most poor in mind. The reason that the governor was mentioning in his budget the need to do something about rural hospitals now, a $1 billion request or whatever it is because 16 closed. And they closed because we didn't expand access to Medicaid. This administration, and you should read the budget. I know you all have read the budget or are reading it, and I'm going through it too. But you will see that we are missing or will lose $6.2 billion compared to last year, from last year's budget. The most significant drop is from the federal government not investing in our state any longer, specifically DHS funding. Read the, but we are in dire straits financially. And I understand there's a debt cliff that we're being driven off of, which is why we need to stop spending trillions of dollars on wars that we don't have any business in, right? There's a way that the federal government could do things to make sure that we got more resources to our states. But the reality is, when we look at what we can do in this moment in time, how are we going to make sure the poorest people in the state of Tennessee get access to health care? Expanding Medicaid is the option that I'm providing, but I am happy to discuss this or any other legislation to make sure the poorest people in our communities get access to health care.
Thank you, Representative Pearson.
I'm good.
All right. Any other questions? Any other comments? Hearing none, I think we are ready to vote. All right. So, Madam Clerk, if you will open the board, and we were ready to vote on House Bill 1393. Everyone voted. Anyone wish to change their vote? All right, Madam Clerk, count the votes, please.
Mr. Chair, you have 2 ayes and 5 noes.
House Bill 1393 fails.
Thank you, Chairman and committee.
All right, that's the business of the committee today. Does anyone have any additional matters? Motion to adjourn.